Alright, so we are back with our third meeting for a 14-year-old young boy named Max. Max has fallen off his skateboard and therefore has fractured his distal radius in his left wrist. He was fully conscious and was able to answer some questions after the accident had occurred. X-rays have shown that his distal radius fracture in his left wrist will require a splint to realign the bone for initial treatment. This is also his dominant hand, so therefore he can't ride, obviously, for school. Max has been experiencing some pain in his forearm, so a mix of ibuprofen and can be given to him to relieve his pain, but of course not too much because he is 14 years old. And he is currently staying in hospital, and a non-prescription medication can be given to him at home, so he can visit the hospital whenever he wants, or he can just stay at home. His past medical history is generally controlled over 2 years. He has no allergies and had his tonsils removed when he was 7 years old. This would not affect the recovery, because this has nothing to do with his distal radius. His previous morbidity is nothing, so that he is independent. Is that it?
Yeah, good job. But like the patient expectation is that he wants to return to playing basketball and riding his skateboard.
So my role is to have consultations with Max and ensure that his mental health is at a peak. And because of the accident, clearly this has not been so. My role is to rehabilitate and educate him and allow him to understand ways where he can improve his mental health. At the moment, I've been teaching him some coping mechanisms and breathing techniques for when he feels left out, and especially since he's unable to participate in basketball, which is his favourite sport. He has been advised to continue to support his team by attending their basketball sessions, but he's doing okay.
Right. Now, what about you?
Yeah, so I've been working with him with strengthening his wrist. Yeah, so I've been referred by the doctor.
Who's unfortunately isn't here for personal reasons.
We've just started physiotherapy.
Yeah.
So he's having a lot of trouble with like his flexion and extension. It's very stiff and sore, and he's still getting some pain there. With his like pronation and supination, it's sort of the same, very stiff, but it's better. And like, like with his wrist deviation, like it's still very stiff. He's also like his fingers are fine, so he will have to so I'm giving you some exercises to do 3 to 4 times a week. So this is like this exercise with his flexion extension. Pretending he's on like a soccer ball in his hand.
Which is good because he can't really use his left wrist just yet, so he can't write anything down for schoolwork and so forth. So her and I have been finding activities and little instruments that he's able to use so he can get his writing ability back and get his education.
Yeah, I've given him. So I've got him to try do some wrist exercises.
Oh yeah.
So he's doing 3-4 times a day, and that includes writing as well. So he should be okay.
As a nurse, I've been just helping him with everything else. So just being there and just watching how he is going. Like as you said, he's been practicing how to write with his hand, and I've been trying to help him with that because he kind of gets frustrated if he can't do it properly. And when he first came in, he said he was in a lot of pain. He rated his pain a 9 out of 10, and that was when he came into the hospital. But now he's doing okay with the pain. I don't think it hurts anymore. He's okay with it. He comes in every week to have a checkup, and then I just assess him, how he's going, and then if he's struggling with anything, then I would let you guys know. But so far he's doing good. Yeah.
He's also been here a few times with me, and so I've been like changing his exercise and modifying it depending on his recovery, so he can return back to basketball and like skateboarding with his friends.
I've been speaking to both his family members as well as Max because of their financial difficulties, and I've noticed that because of his mother's work schedule, she's unable to attend to his needs after school. So, is it potentially possible for you guys to book his appointment and leave a bit of room for him in case he can?
Yeah, that should be fine.
As long as he's okay with it, then we're okay.
Yeah.
That's all we can just say about that.
Does he have any grandparents who can take him?
I have to ask him about that.
Yeah, I work with his mum, and she's because they do have after school care at his school, so his mum is kind of thinking of doing that as well. She hasn't really talked about it yet, but she's thinking about it.
And you can imagine, because he can't write, then like it'll be hard for him to get an education. I've been looking up and just trying to be finding any of his relatives to see if they can like write down some notes for him. Or if it's like that much of a trouble, we can just bring your laptop for him and he can just type the information up on his laptop and just print it out.
Yeah,
Just
I was
review
going
it.
to say, he's no problems with his fingers, so a laptop should be okay.
Yeah.
I think wrists might get really sore and stiff, so I recommend doing exercise if that does happen.
Is he currently prescribed on any medication at the moment? Because
Only just simple painkillers like ibuprofen.
Yeah.
Because I was considering.
Yeah, I recommended he takes about 1 tablet a day just because he's still young, and since the pain isn't there much anymore, I only recommend it when he really needs it. Like if he's writing and he's been writing for quite a long time, he might hurt a little, so that's when I do recommend him to take it. But other than that, he's okay with the pain, so he doesn't really need it.
Because of his family problems, I've noticed that he's under a little bit more emotional distress because of that. And if he doesn't find ways to cope with it efficiently, then he may need antidepressants. So I asked you guys about the medication because Prozac and Lexapro may not work alongside with other medications. So
at the moment, he's not taking much medication other than just painkillers. So I think he should be fine with that,
Yeah, so with the wrists exercises, it should improve and get it better over time.
Yeah.
Yeah, it's just his wrist definitely lost a little strength in it.
Yeah.
So I'm working him so I can try and get back.
And because he's improving over time, I was wondering if with the physiotherapist, I was able to visit their house and like check if there's anything extra needs to get put into his house that may aid him with the recovery or so on and so forth.
do we have any social concerns for
Social concern.
I think his mental state really, if he's able to cope
Because
with the separation.
Because my concern was he's mentioned that he's felt a loss of independence because he's unable to do basic tasks himself, such as cleaning and bathing and putting clothes on himself, basic things. And at his age, independence is something that's very, very important to them. And that's just my concern, is that he may feel more isolated. So maybe creating links and establishing stronger family and friendship ties may help out.
The last time he came in, he told me that he still goes to the skateboard park with his friends. He just doesn't ride on it just to be careful, but he is there, and a lot of his friends are actually there to socialise with him as well. But he did mention the fact that he does feel a bit left out, the fact that he can't, go and skateboard and, do activities. So,
Yeah, it should only be a few months of physio, and he should be back to play basketball and skateboarding.
Yeah.
We just don't want to do anything at the moment because it could re-injure it and make it worse.
We could potentially find alternative sports that do not involve the movement of the wrist, such as soccer, chess, and squash.
Do we have any goals for Max for him to achieve the next time we have a meeting again?
Maybe to
want him to have less, be able to have more wrist deviation and like be able to move his wrist better.
A bit, yeah.
Just have less stiffness. And I definitely want to see improvement. But that's on his behalf. He needs to be doing the exercises 3 to 4 times a day that I'm giving him.
And it has, if he's actually motivated to go through it. And my goal of the week is to either find an assistant for him that can write down any notes, or actually ask him if he's okay with taking a laptop to school and writing work down from school. Do you have any other goals for him?
My goal is for him to potentially accept, just for a short period of time, that it's okay to ask for help, and that he improves his emotional state, especially to do with his family. He's not speaking to his father, which Max has given us permission to talk about non-confidentially, and I believe that he'll get better, and if he doesn't, antidepressants.
For me, emotional state is okay and everything else is okay. Just sometimes he misses his appointment or he's a bit late to his appointment, and it's kind of hard to reschedule that. So I don't know if that's because he just forgets about it or his mum can't drop him off or something. But we did have to schedule a few appointments time, so I think if he's on time, then I think everything should be okay.
We could talk to his school and see.
See if anything's wrong.
Or anything, or someone can take him to an appointment.
It's also possible to talk to his sister about it, and if she could have the responsibility of taking him to his appointments.
So we did try to organise appointment after school, so not during school, because then it would be a bit difficult to go back and forth. So we did try to get appointment after school.
So is there anything else we need to add into Max's recovery? Any extra comments or?
I think we should just remember to use language that we can speak to him about. Something that's not too
personal.
Medically, and because he is
they
14.
can easily understand and know what we're talking about.
Because you want him to know where he's at the same time as where we, you want to be on the same page with everything.
Obviously. Our next meeting will be the same time next week, I believe. Is everyone okay with that?
I think the doctor.
And
So next time, Dr. Campbell will be able to be here. Yes.
I guess that'd be some good insight on how he's going as well. In terms of recovery.
Excellent. That's a wrap.
That's a wrap, team.